It's been a difficult time period, not just for those who are mentally unwell before going into this, but also who have become mentally unwell during this. Fear of catching COVID, um, fear of not being able to see the loved ones, not being able to share family time, and just really having their own sort of freedom taken away from them to protect themselves. So it has been a difficult time. Our services have seen record requirements, record calls, and in all essence, it's been a difficult time for people with mental health. There's also been a positive, and I think it's always a good idea to have a very balanced view, because mental health does sometimes gets a little bit, um, bit of a stigma attached to it and discrimination. People have come together. People have seen that you got to find out what the neighbours' names are and seen that they have people around them that they may never have been in contact with before. I've seen a great movement in our volunteer sector with the local groups setting themselves up over in every ward in Warrington, the central 6 wards. They've rallied round tirelessly to help their neighbours and to give of their time freely. One of the most positive things I've seen is some people with mental health issues before we come into this, lockdown, have actually brightened up. And the reason they brightened up is they started to see everybody else in the same position, being stuck in the houses day after day, being, expected less of them. So they've been able to actually take stock and just take some time out and see that the world isn't as fast paced as anything else that was around them at the time. So it's actually given them a bit of a break and give them a bit of a time to reflect. We have had some emergencies and we've had to work closely with Cheshire Police and even Merseyside Police, the fire brigade and the North West ambulances, and all our emergency services were absolutely fantastic. All our key workers, everybody else who are out there, just, clapping for them on a Thursday and everything else. The wonderful work them and, the heroes in blue as they're called, have done is just quite astounding. But my heart goes out to each one of the volunteers who stepped up and have done what they needed to do. There's a hidden army in society, and that is the volunteer sector. And if we all took a day off, then, some services would struggle. So I think out of the whole of COVID and the mental health pandemic that was on its way anyway, that continues to rise, and it will be the volunteer sector who will be helping, fill that gap, fill that void. Whether we get a second wave or not is kind of immaterial for mental health, to a degree that the mental health hasn't peaked yet, and people are still at home, still isolating, still struggling. Businesses have been lost. Some shops are not reopening because they've lost the jobs and because of, lost revenues. We're in, for me, a longer state of support and guidance being needed. And there's only one word that will fix that for me, and that is collaboration. That means coming together. That means working together as a town, as a neighbourhood. So let's hope that continues. Let's hope that new way of thinking, new way of working going forward continues, and everybody gets what they need. So stay safe. If anything that Rise can do for you, just check us out on Facebook. anything that you know, the whole voluntary sector can do for you, then there's Warrington voluntary action there for you. And just stay together, stay safe, and keep well, keep your distance, and be more than anything, be kind. That's all we need.